Hello guys, welcome back and you're watching your medicine channel MMS, which makes medicine simple. Yes friends, medicine is fun if we make it simple. So in our previous lecture, we have discussed about the diagnosis of rheumatoid arthritis from the rheumatology series, and today in this lecture we will talk on prognosis in rheumatoid arthritis patient, right? So what is the meaning of prognosis? So basically this is a medical term for predicting the likely or expected development of a disease, right? Including whether the signs and symptoms will improve or worsen or remain stable over the time. So, as we already know that rheumatoid arthritis is an autoimmune, chronic, symmetric, systemic, inflammatory type of arthritis and which is common in females, right? So, this is the picture of one of my rheumatoid patient, and she is my imaginary patient and her name is Simran. So as this is systemic and inflammatory chronic arthritis, so definitely patient will have both articular and extra articular manifestations, right? So as we have one rheumatoid factor, that is an IgM against the Fc portion of IgG, right? Also there will be elevated levels of ESR and CRP, the inflammatory markers, and hepcidin and platelets, the acute phase reactant, right? So in articular manifestations, there will be involvement of PIP, MCP and IP, right? Also atlantoaxial joint. And when we talk about the extra articular manifestations, right? So patient will have ophthalmologic manifestations, CNS manifestations, right? Subcutaneous nodules, vasculitis, pericarditis, pulmonary fibrosis and pleuritis, hematologic abnormalities like anemia. So now let's talk about the factors which affect prognosis in rheumatoid arthritis patient. So before we talk about the factors affecting the prognosis in rheumatoid arthritis patient, let's recap something important. So as we already know that rheumatoid arthritis is an autoimmune, chronic, systemic inflammatory disease which affects your small joints but symmetrically, right? And also this is common in females. The female to male ratio is 3:1. Patient with rheumatoid arthritis might have both articular and extra articular manifestations, right? Because this is the systemic type of arthritis. Also, patient will present with the cardinal signs of inflammation, such as redness, swelling, pain, hotness, disability, which will be worse in the morning and improve as the day passes with physical activity. Also, the level of ESR and CRP will be elevated in rheumatoid arthritis patient, whereas in osteoarthritis, which is an asymmetric and non-inflammatory type of arthritis, so there will be no cardinal signs of inflammation. Also, the ESR and CRP level will be normal, and the stiffness and pain will be worse in the evening. So now let's talk about the factors which affect prognosis in rheumatoid arthritis patient. So these factors are age of onset, gender, genotype, and phenotype. That is extra articular manifestations or variants of rheumatoid arthritis and comorbid conditions. Also, almost 10% of patients with inflammatory arthritis who are fulfilling the ACR classification criteria for rheumatoid arthritis will undergo a spontaneous remission within the 6 months, especially the seronegative patients. Also, it's important to note that majority of rheumatoid arthritis patients exhibits the persistent and progressive disease activity that waxes and wanes in intensity over the time. A minority of patients shows the intermittent and recurrent explosive attacks of inflammatory arthritis. Also, the overall mortality rate is 2 times greater than the general population in rheumatoid arthritis, right? Ischemic heart disease is the most common cause of death followed by infection. And the median life expectancy is shortened by an average of 7 years for men and 3 years for women. And the patients with shortened survival are the patients with systemic extra-articular involvement, low functional capacity, low socioeconomic status, low education, and chronic use of prednisone. Also, around 40% of patients with rheumatoid arthritis become disabled after 10 years of disease duration. So the treatment with DMARDs in early rheumatoid arthritis gives the best opportunity for attempting to achieve disease remission. Early RA means when the symptom duration is less than 12 weeks at the time of first treatment. So please take a note that these are the poor prognosis factors in rheumatoid arthritis. So these are HLA-DR for genotype, high serum titer of autoantibodies such as rheumatoid factor and anti-CCP, extra articular manifestations, involvement of more than 6 joints, age younger than 30 years, female sex, constitutional symptoms, radiologic evidences such as erosion and narrowing of joint space, also high level of ESR and CRP, the inflammatory markers. So this is all about prognosis of rheumatoid arthritis patient, right? In next lecture, we will talk about the management of rheumatoid arthritis. So thank you so much guys for watching, and please do subscribe the channel to get all latest videos like this, and also help my this beautiful imaginary patient Simran to reach and teach more and more people like her about this nasty disease rheumatoid arthritis. Stay safe, stay healthy, study a lot. Thank you so much guys.